So good evening, everyone. I'm Joe Sawyer, the superintendent of the Shrewsbury Public Schools. I welcome you to the Shrewsbury Public Schools webinar on youth mental health and well-being. This evening, I have Mr. Todd Bazydlo, the principal of Shrewsbury High School, and Mr. Jim McCauley, who is an expert in youth mental health from the Riverside Trauma Center. We're holding this webinar as part of our ongoing efforts to support the well-being and mental health of the students and youth in our community. As I indicated in the invitation to this, we are very concerned about the continuing crisis we're experiencing among youth mental health. It seems to have intensified over the past month or so. We have been seeing more issues of students requiring emergency mental health services, demonstrating self-injurious behavior, suicidal ideation, and actual suicide attempts. It is something that we are incredibly concerned about, of course. This is not unique to the Shrewsbury community, and I know Mr. McCauley will speak about that, but it is something we're experiencing across our nation, in American culture and society, and it's something that together as a community, it's important we continue to come together to do the best we can to support our students and to try to prevent the negative effects of mental health challenges. So we really appreciate you being here this evening. At this time, I'm going to turn it over to Mr. Todd Bazydlo, our principal at Shrewsbury High School, who will introduce our guest.
Thank you, Dr. Sawyer. I want to thank Mr. McCauley and the Riverside Trauma Center for helping us out and being a part of this important webinar tonight. Jim McCauley is a co-founder and associate director who provides mental health support for schools, workplaces, and communities affected by traumatic events. He's consulted with numerous schools and communities in Massachusetts and New England on trauma responses. He has provided consultations and trainings on suicide postvention services, suicide clusters, and suicide prevention coalitions. He has presented at the statewide, national, and international conferences on these topics. He has an extensive experience in providing therapy to children, adolescents, and adults, and has previously managed outpatient mental health clinics and programs for children for more than 20 years. Jim is a graduate of the Boston University School of Social Work. He is also a senior lecturer in the sociology department at Suffolk University for more than 30 years. He's an Army veteran and has a special interest in developing and providing services for returning vets. So welcome, Jim McCauley. Thanks for joining us, Jim.
Well, thank you so much for the invitation tonight. And I just want to acknowledge that this is a really difficult conversation to have, that no parent, I think, ever imagined that they would sort of have to have this kind of conversation with their children. But as you heard, I mean, Shrewsbury, you have amazing staff that cares deeply for the kids and wants to do to keep kids. It's your help. Absolutely need the help of parents. We have a situation in the States where schools have ended up primary mental health for children under the age of 18. For this role, they are not fully trained to this role, and it's not very fair. They don't get the financial backing that they would need to do this, but reality is that schools are primary mental health resource for children. But let me just sort of say something, that what's happening in Shrewsbury is happening across the United States. I think before COVID, about 30% of high school students would report being depressed when they were asked on the Youth Risk Behavior Survey. This is true in almost every state in the country. We see these extremely high rates of students feeling depressed. And this is before COVID. 18% of students reported experiencing suicidal ideation, that they had seriously thought about suicide at some point. And about 7% of students reported during that school year that they had made a suicide attempt. Now, this is a self-reported suicide attempt. About 2 to 3% of students make a suicide attempt that requires emergency medical care. And so these are pretty significant numbers, even before COVID. And since 2020, things have gotten increasingly worse for kids. Pretty recently, we saw kids saying, or we got reports that about 51% increase in girls making suicide attempts ending up in the emergency room. And we've also seen kids who are in the 10 to 14 age group that suicide deaths have increased significantly in that population. And then even in communities of color, we've seen marked increases in suicide deaths. In the last 5 years, there's been about a doubling of suicide deaths in young Black adolescent males. So you can see it's quite significant. And I think one of the things that I want to emphasize more than anything else is when we talk about suicide, suicide is always complicated. There's always a multitude of reasons that someone makes a suicide attempt. I think sometimes you hear things in the press or whatever that that a student made a suicide attempt because of academic stress, or because they didn't get into the college of their choice. And you'll hear these sort of single factors as being why this student died. And in almost every case, it's much more complicated than that. It's almost what we sort of talk about when we describe a perfect storm. And so why in the world would anybody, think about suicide? And I think our definition at the Riverside Trauma Center has always been that suicide is an attempt to escape from intense pain and hopelessness. And I use that word escape. It's pretty important because oftentimes people will say, I don't really want to die. I just want to escape this intense pain that I'm in. And so, if we can relieve that, if we can find ways to relieve that pain, if we can intervene early, I think oftentimes we can get people, whether they're young people or adults, through that suicidal crisis. And when I say suicide is complicated, there's almost always an underlying vulnerability. And we talk about risk factors and warning signs, but the major underlying vulnerabilities that we talk about tend to be a history of trauma, students that are either experiencing depression or anxiety, or students who are struggling with their sexual identity, sexual gender issues. And again, it's not because of their own struggle, it's because they feel like they're not getting enough support from their community often. When we talk about complications and we talk about adolescents, one of the major factors is just that adolescents, just because they have a brain that's not fully developed yet, they are very likely to be impulsive and act in a very rash way on the same day that they have some kind of a conflict or crisis. So, that is one of the factors that I think is fairly unique to adolescents. Oftentimes we hear themes of burdensomeness and lack of belonging that are driving suicidal thinking. And when you hear that, oftentimes what you hear is a young person saying, I just feel like a burden to my family and friends. I feel like they would be better off if I were out of the picture. Now, of course, nothing could be further from the truth, but that's how they feel in that moment. I mean, people who are in a suicidal crisis almost always have this distorted thinking, and they have sort of tunnel vision, and they can't think of any other way out of their problems. The other factor that we see is just a sense of not belonging, and they oftentimes feel just isolated, cut off from others, or misunderstood. And sometimes this is a huge surprise to everybody because they look like they have a lot of friends, they're active actively involved in school activities and clubs and sports, and they have a really supportive family, but inside they may feel like an imposter. And they think that if people knew who they really were, that they wouldn't like them anymore. Suicide risk is dynamic. And by that, I mean that I think most people imagine that someone in a suicidal crisis is suffering on a persistent basis for days, weeks, months on end. And in some cases that's true, but more often than not, what we see is that suicidal ideation fluctuates tremendously throughout the day. So that a student can feel suicidal at 8 o'clock in the morning. By noon, he or she's not thinking about it at all. And then by 5 o'clock in the evening, they're thinking about it again. So that sort of roller coaster effect that we see in suicidal thinking is fairly common, especially for adolescents. Now, despite all the money and dedicated to research around suicide, we're still no better than chance at predicting who will die by suicide. So that's why we really welcome the opportunity to get in front of every audience and talk to them about suicide and how they can support family, friends, colleagues at work, people involved in their church when they're worried about somebody. And we really encourage them to not be afraid when they hear about people that are struggling, people in their life who are struggling, to not be afraid to go ahead and ask about suicide. Less than 50% of people who die by suicide have ever seen a counselor. So that role of what we call a community gatekeeper, someone who knows the warning signs, is a good listener and not afraid to offer support to someone who's struggling. And then this is so important in the school community. I talk to schools about this issue all the time, is that the number one protective factor against suicide are social connections. So feeling like you belong, feeling like you've got friends, that you're active, people want to engage with you. Those social connections are really incredibly important. So we're asking for your help. How can you support your child? And I think one of my favorite acronyms is WAIT, WAIT, which stands for Why Am I Talking? It's so hard for us as parents. We know, when our kids are talking about problems that they're experiencing, we know what the likely answer is, what the solution is. And it's just so easy that we want to tell them. But a lot of times they're going to need to figure a lot of that out on their own. And they just want us to listen, to just be good listeners. People who are in crisis frequently tell us they don't want people to try and problem solve with them. What they want is they just want somebody to listen to them and hear their story. So that idea of kind of being an active listener is really key. The other thing I would say is don't assume that your child is okay. Ask them. Don't be afraid to ask them. And I'm going to give in a minute, give you some tips about how to ask. But don't be afraid to ask them. And then what I always say is always ask twice. Think about this for a minute. We have this social contract in our country where we ask people, how are you? And the expected response from both sides is, I'm fine. But if I say to you, no, really, how are you? Then you say, oh, he really wants to know how I am. So that idea of asking twice, that follow-up, I think is really important. And I think one piece of advice that's important is to sort of lead with I statements. So in other words, don't say to your kids, you're not behaving correctly, or you're depressed, or you have a substance abuse problem, or you need to do more in school, lead with I statements. You know, I'm worried about you. You know, that kind of, if you're worried about your kid and you lead with a you statement, they can always say, no, I'm not depressed. But if you lead with that I statement, I'm worried about you, I'm worried that you might be depressed, they can't say, no, you're not. You do. So that's sort of a good strategy to use. And the other thing too is that you have to find the right time and the right place to have this conversation. You have to do it on your child's time. So when is a good time to talk with them? And I think probably all of you have ideas about when your child, especially your adolescent, might be more approachable. Now, I have a son who's doing fine now, but he really struggled mightily when he was in high school. And he would talk to his mother more than he would talk to me. But when he would talk to me would be when I would pick him up from an after-school activity, and we'd come home and pull into the driveway. It's dark outside. I turn off the engine. That's when he would talk. We couldn't make eye contact. We were sort of sitting parallel to each other, not facing each other. That's when he would open up and talk. And so we would sit there in the driveway for 15, 20 minutes having a pretty important conversation. So when is that good time to reach out to your son or daughter and have that conversation with them? The other thing I would say is ask open-ended questions. Be really curious. Let your child be the expert about what's happening in their life and in their school life, in their world. So oftentimes it's helpful to start with larger questions. For example, you can even sort of say, hey, I went to this parent workshop last night, and there was a lot of conversation about what's been going on at school and kids struggling. And I'm just sort of curious, what do you think? What's the mood been like in school for you? You know, kind of let them sort of talk about what's happening in school in general. And then drill down a little bit more and just like, well, how about your friends? What kinds of things are they saying? What kinds of responses are you seeing with them? And let them talk a little bit about their friend groups, or maybe any sort of teams that they're on or groups that they're involved in. And then lastly, then drill down to, and how about you? You know, what's been happening in your life? How are you doing? And again, like I said, don't assume your child is okay. So I think you want to ask them, just like, if you were in trouble, who would you turn to? And let them be honest about that answer. Now, 90% of kids are, and most often are going to say, well, I would talk to my mom, I would talk to my dad, but sometimes, remember that theme of burdensomeness, they're worried about you. They may feel like you've been experiencing a lot of stress in your job, certainly a lot of stress of just what's going on these past 2 years. So they may feel like they're a burden to you. They don't want to do that. They don't want to tell you just how bad they feel. So who is that person that they would go to? If they felt like they were in trouble, they were scared, they didn't know what to do, ask them who that trusted adult is. Shrewsbury does schools do a great job of using the SOS program, the Signs of Suicide program. And that's an important component of the SOS program, is who are the trusted adults in your life? And we want kids to have a trusted adult inside of school, and we want them to have a trusted adult outside of school. And oftentimes kids say, well, if I was in trouble, if I was worried about something, I would never tell an adult. And you say, oh, how come? And they say, well, because adults overreact. And I oftentimes will say, well, you know what, you're right. Most adults probably would overreact. But who are the adults in your life that don't overreact? And they start to think about that, and they come up with people that sometimes might be a surprise to you. Well, they might say, well, I might tell my my traveling basketball coach, or they might say, well, I feel like, Mrs. Smith, my math teacher, I feel like she really gets me. I think I could go to her. And then they might say, then you can ask them, how about outside of school, after school, weekends, school vacations, who's that adult that they would go to? And again, have that conversation with them and help them identify who those adults are that they would go to if they're struggling. And what that does is, it's a great conversation to have, but it also is what we call behavioral rehearsal, so that 2 months from now, 3 months from now, something happens, they're scared, they know something, and they're worried about a friend, or they're worried about themselves, and they wonder who they should tell. It sort of pops into their head. Oh, my traveling basketball coach, or, oh, Mrs. Smith, my math teacher. So that's can be a really important step. If kids can identify those two trusted adults in their life, ideally outside of you as parents, I think that would be a great protective factor. I think it's important for family values that you equate mental health with physical health, so that we don't hesitate if our children are sick, they've got some medical issue, we're worried about their physical health. We don't think twice about making an appointment for them to see their pediatrician or a healthcare provider. But we don't do that with mental health. We let it simmer too long. We don't identify resources early enough. So I think a good plan of action is to really have that family value where you equate your mental health with the physical health. And in that same vein, one of the things that I would say is that you have to regulate your body to regulate your mind. And so finding ways to move, finding ways to exercise, to get outside, to play, to walk, to go for a run, participate in activities, whether it's individual or team activities, or whether it's as a family, getting out and regulating your body is probably the most important thing that you can do, most important action that you can take to support your child. And if they're regulating their body, they're going to be able to regulate their mind, and they're going to be able to manage their anxiety, manage their depression much more effectively. One of the things that I hear a lot from schools these days is that kids, they don't have enough skills, life skills. They're not as good as managing distress as they used to be. They don't have as much independence as they used to have. And that's difficult for parents. That's always difficult for us parents. We want to try to find that fine balance where we can nurture our child, but also encourage their independence and encourage their skill building. I think those are some of the key points that I really wanted to make. And also just kind of knowing what your local resources are, I think is essential. You have the in Massachusetts, we have 24/7 emergency services available by phone. That's a great resource. We also have the suicide prevention Lifeline that's there 24/7. That number is 1-800-273-TALK. And as of July 1st, that number will be 988. That's a new feature that's coming out, which everyone is anticipating that it will be a sort of a huge boon to people being able to remember that number and get help. We're expecting the increase in calls to probably triple or even quadruple over the next couple of years. So know those local resources. Don't hesitate to use your school contacts to get advice and check in with them. And I am going to stop talking now, and let's see if there's any questions, comments, feedback.
Sure. So Jim, quick question, and maybe I can throw out to the community as well, is our community, we're receiving an email from health teachers. We're actually going to be doing signs of suicide in grades 9 through 11 next week in our health classes. So if you're at the high school, you should be receiving an email communication from your child's health teacher. We're going to start screening next week for those that are enrolled in health for second semester. We'll be conducting signs of suicide program at the high school next week. That being said, I guess you hit on something around, Jim, around finding resources for people to talk to. Now, we know there's a mental health crisis. In my experience, I know Dr. Sawyer can also speak to this based on what he's hearing from other schools. It feels like there's a lack of therapists, or there's long wait lists. Do you have suggestions for people who are in the audience that may be saying, I really equate my son or daughter's physical health with their mental health, yet I'm really struggling to find services for my children right now? So we've got that piece together, but the hard part is there's these long wait lists, or they're pay as you go, they're very expensive. So do you have any suggestions on parents out there that might be looking for some advice in that area?
I mean, you're right. It's quite bleak. I mean, it's always been difficult to find good mental health resources, particularly for children, and it's much harder these days. But I think I would say, if you have the opportunity, get your child on a wait list, and don't just hang up if they say there's going to be a 2 or 3 month wait. Go ahead and get your child's name on a wait list, and maybe you'll get a call earlier. But I think also asking your pediatrician for support. Now, I think one of the features about some of the healthcare centers these days is that they do have behavioral health services on site in primary medical settings, both for pediatricians' offices as well as for adult health clinics for your primary care physician. And so that's a great way to sort of get a consult and get a foot in the door that I would recommend. The other thing, I think Shrewsbury is part of the William James Interface Referral System. I think they have been, that has been such a wonderful resource for communities over the years. Now they are swamped as well, but again, try to get your name on a wait list. I think that will, that's one of the things that you can do. But in the meantime, just providing that support for your child, I think can be huge. Helping them identify what are some of the triggers when they know that they're in trouble, and kids will know that. Oftentimes they'll say, well, when I start having really negative thoughts, or when I start feeling hopeless and giving up on sort of my schoolwork. And when they identify those kind of sort of triggers that they're noticing that they're getting into trouble, what are some of helping them identify some of the things that they know can be helpful for them? So, for example, just like, what helps you when you're struggling? And oftentimes kids can identify that, and certainly for adolescents, almost always the first thing they say is their playlist. So they'll build out their playlist and think about that. There's amazing apps that they can download. Many of them are free. For example, there's the Hope Box, Hope Kit. That's a good app that's free that they can download. Also, there's an app called Safety Planning, which is something that you can help your child build out as well. So that virtual Hope Kit and the Safety Planning app are sort of two resources that you have, and just helping them identify people again. What are their ways, that coping strategies that they have that can distract them from thinking about their problems. Distraction is a great coping strategy. Exercise is a great coping strategy. And then identifying those people in their lives who they can go to when they know that they're struggling. And I think those are sort of things that you can do in the interim until you can access good mental health services.
So Jim, you bring up a good point. We've worked through the school with this in terms of reaching out to a pediatrician, trying to get on that wait list. I also recommend using your network of people, your contacts, your friend circles, your trusted people within your own parent community to try and see what they've experienced, what they've heard, who's available. Because of the lines or the wait lists are so long, that's definitely a resource you should look into. I also could suggest, reaching out to a school counselor. We may be able to provide and have some insight relative to ideas of where we can refer people or where they can try and find some treatment. And that includes our partner here in town is Shrewsbury Youth and Family Services. I know they're very, very busy. I understand that, but they're constantly trying to add clinicians and add more bandwidth to help with our community. So certainly that's another resource we have in town.
Yeah, those are great resources that you have in Shrewsbury.
I think too, I know someone put in the Q&A that sometimes, excuse me, some health insurance companies will help for searching for psychologists with openings. This particular person says they've used Blue Cross, Blue Shield for that. So reaching out through your health insurer, if you have health insurance, is also another possibility. Moving on to a different question at this point. I think that there's been a few different questions that have come up here asking about students who are exhibiting, young people who are exhibiting certain behaviors such as cutting, and is there a correlation between cutting and suicide? And what is it that, and sort of beyond that, if you become aware of someone who's experiencing what seems to be a real significant mental health or behavioral issue, what do we do from there? But let's start with the cutting, which is that self-harm is something that we've seen more of, and maybe if you can speak to that first, Jim.
Yeah, so self-harm definitely is something that you want to make sure that you get a consultation about. But the dynamic is actually different than suicide. When suicide, when somebody's thinking about suicide, they're trying to think about how to end their pain. And when someone is engaged in self-injurious behavior, they're actually trying to feel better. And so they actually, it's not a good coping strategy, but it is a coping strategy. And they feel better for maybe 30 minutes, an hour. And that helps. And sort of that's how it can quickly become a habit. But it's a coping strategy. And I think understanding that is important, but then also trying to help build other coping strategies is really the key to helping somebody get over that.
Hey, Jim, this is a very important question. I know we've met with your colleague at Riverside Trauma Center, Larry Berkowitz, in the past, and he's been a great resource for our school community as well and our entire community. But there's a question came, is there any evidence to indicate that too much talk of suicide actually introduces this idea of a child who might not have accepted the idea as quote unquote mainstream, in other words, and does the SOS program that we offer here at the high school and across the state normalize thoughts of suicide?
It's a great question. It's a very common question. I think sometimes people are worried if they bring up the topic of suicide to somebody who's struggling that they may be planting the idea, but nothing could be further from the truth. When you are talking with somebody, whether it's your child or a family member or a colleague, and they're talking about how much they're struggling and just sort of how much they feel like they're a burden to others and that they're in pain, and you ask them directly, if you ask them if they've thought about suicide, they often feel validated. They feel like, wow, somebody finally understands just how bad I feel. So I think that's, if you're thinking about ways that you can kind of shift the narrative, I think one of the things that you want to do is really kind of talk about just we want to have a community, we want to have a school community and the Shrewsbury community where nobody worries alone, that everyone who wants help, we're going to try to support them in our community. There are multiple pathways to getting help. Not everybody, I mean, here I am a therapist, right? But not everybody needs to be in therapy. Sometimes those ideas of building social connections, that may be a much more important intervention. And those social connections have to be something that young person is interested in, right? I mean, and you have to, it may take a while to sort of figure out, what appeals to them. It may not be a large social gathering. It may not be a team sport, but maybe it's a Lego club, or maybe it's a robotics club, or maybe it's joining a music group. Whatever it is that sort of gives that young person a sense of belonging, I think is really key. But yeah, I know that question comes up a lot, and SOS is the most well-researched suicide prevention program for youth out there. And there's no evidence that program, and what we know is just the opposite, that students that have been through the SOS program have about a 40, anywhere from 46 to 64% reduction in suicide attempts. So it's an extremely effective program. I think I would say you probably have no reservations in having your child participate in the SOS program.
Thank you, Jim. I think another question here that's important. It says if parents or caregivers become aware of a person who's in need of emergency mental health support, they see a social media post, they get a private message, or their child gets a private message from someone else that they share with their parents, and it's outside of the school day. What are some steps that family can take to try to help that other individual, that other youth?
So I think getting a consultation from, I think anyone can call the suicide prevention hotline, and they will offer you a consultation. And I think that's probably a sort of a good first step. I mean, we also have our the emergency services team. I think we should maybe try to get that number out to families, your local provider for that region. Probably get that number out to them. But I would start, if it's after hours, I would start with the suicide prevention Lifeline.
I know we also tell people, of course, that if you feel someone's at risk of imminent harm, that it's always appropriate to call 911.
Yeah.
You could also call the Shrewsbury Police line directly, the dispatcher, if you don't want to call 911. They can assist you. Our Shrewsbury Police have been enormously helpful in responding very quickly and skillfully to situations. I know actually we had one just the other day, Mr. Bazydlo, where we became aware through students that there was a student at home that people had some concerns about, was not in school. Our school resource officer immediately contacted his colleagues, and there was a wellness check, immediately to that student's home. So I think, we would rather someone err on the side of being overly cautious than not when you think someone might be at risk of imminent harm. That's something, of course, if it is during the school day, you become aware of something, you're always welcome to reach out to us at school, and we can route that situation as we feel best based on the expertise of our counselors, school psychologists, et cetera. So I think that's also important, emergency services when appropriate. Todd, how about another question?
Yeah, so I guess a couple of things, and for the community, like some of the things that we're doing in the district, Dr. Sawyer and Jim, and for everyone listening, is we're trying to build those protective factors through programs like our advisory at the high school and middle school. We're trying to build connections with trusted adults. Teams and clubs and activities are certainly we want students to participate in those activities. I think, Jim, you refer to those as pro-social behaviors. We're having a campus cleanup this weekend from 10 to 12. We put a post out on Schoology for the high school students to come out and connect with their coaches and staff members to do a 2-hour kind of walk and pick up some litter and do whatever around the school building. So I think those are important opportunities for people to share with their kids and find and test things. I guess a question I have too, and it's come up in a couple of these comments, Jim, and I'll try and generalize these, is when we have family members or we know someone in the community, whether it's in our community or a different community that has someone in their family that has been affected by a suicide attempt. There's this feeling of we know something happened in a different family. What can we do as a supportive member to best support the family where this kind of crisis has happened?
I think just reaching out and just letting them know that you're thinking about them, and ask them directly for how you can support them. And oftentimes, certainly when there's been a suicide death in a community, there's often someone in the immediate family, or maybe it's a next door neighbor, who is sort of helping them kind of manage the calls coming to the house and people coming to the house. And oftentimes that person knows best what the family's needs are. So reaching out to that person and finding out, that next door neighbor, and finding out, what can I do? How can I help? I want to be supportive. I think is probably the number one thing. And oftentimes it's just helpful to just, if you know a family well and they've been struggling, to just, if you know that there's something that they need, if you know that, for example, that their lawn needs to be cut or their lawn needs to be raked or whatever it is, to just kind of go ahead and do it, rather than just saying if you need something, let me know. But I do want to come back to this theme of helping others that you mentioned, Todd, because I talked about this issue of burdensomeness, feeling like oftentimes people in that suicidal crisis feel like a burden. And what's the antidote to burdensomeness? It's helping others. So anything that you are engaged in, that your family's engaged in, that is helping other people, when we do that, when we help others, we are the primary beneficiary of that. We benefit more than the people that we're helping, whether that's working for Habitat Humanity or helping clean up the school on a Saturday afternoon. All of those kind of things that we do to support other people are really the sort of the antidote to burdensomeness, and encouraging your kids to get involved in those kind of activities, mentoring some of the high school kids, mentoring younger students, for example, being a counselor in a summer program. All of those things sort of go a long way to making us feel like we have a role in supporting our community.
Thank you, Jim. A couple people came on late, asked if we'd recap, and we are recording this, and the recording will be made available once we're able to get that uploaded to our website, and we'll communicate that out along with some of these. We've been trying to communicate periodically different links and phone numbers and things to reach out for support or emergencies, and we'll continue to do that. Another question, just tying back to the Signs of Suicide program, someone was asking if every student in Shrewsbury High School will experience that. And Mr. Bazydlo can correct me if I'm wrong. All of our students in 9th, 10th, and 11th grade do experience that when they take their health class. Some students take that in the first semester, some take it in the second semester. It's a semester-long course. We actually had asked Jim when we met with him a week or so ago, because we had seen this uptick in serious situations. And what about our seniors at the high school? And I know, Jim, your advice was that most of them have been through it 3 times, that we want to think about maybe some other things and just reminding them of some of the themes there. Seniors don't get it because they don't have health senior year, but we are taking some steps to make sure that we are paying attention to our seniors as well. So I just wanted to mention that based on that question. Jim, a lot of the questions are asking about the correlation between social media, screen time, smartphones, younger and younger kids with smartphones, in terms of this uptick and we know that this increase in moving towards a mental health crisis among young people happened before the pandemic began. The pandemic has amplified it. But can you talk a little bit about the role or what parents and families should be thinking about where it comes to students' consumption of social media and use of smartphones, screens, that sort of thing?
Yes, if when you can, I think especially this probably advice will be more beneficial for parents of younger children. But if you can limit social media to a couple of hours a day, I think that is really an effective intervention. What we have seen is since about 2009, we have seen a 30% increase in suicide deaths of young people. And 2009 is about the time the iPhone came out. And I think it's not coincidental that kids are spending more time on social media. They are feeling, you hear kids talking about, FOMO, right? Fear of missing out. They always feel like everything that they see on social media means that everybody else is having a much better time than they're having. And it's a serious issue. So I think when you can, I think for younger children to make sure that that as much as you can, that you're limiting the use at night. I think there's a pretty good correlation that we see a significant increase in suicidal thinking and behaviors when kids are on their phone more than 3 hours a day. So I think if you can limit that, and again, this is something I think that the parents community can take this on and address it as a group of parents, because there's so much pressure that young people have to get a phone, and if parents are giving into that, then it makes it much harder for other parents to not give in to that. So if parents can sort of set the bar across the community, I think that would be the best case scenario.
So Jim, a couple of questions also regarding to some interim steps or strategies for students who are dealing with either what they would consider some severe anxiety or maybe sad depression. Are there interim steps if we can't get that therapist or we get on a waiting list to see someone? Are there things that or other alternatives that people could take relative to a meditation, mindfulness, or CBT, something that could help the cognitive behavioral therapy that I know that some people have been enrolled in and participate in? Is there suggestions to have an interim step as kind of while you wait?
Yeah, that's a great question. What I would say is that try to get on a waiting list, but in the interim, I think any kind of mindfulness techniques, there's some really good apps out there. For example, Calm, CALM, is a good app. And learning, two things that I would say are probably most important for kids that are anxious is learning how to do some good breathing exercises and also exercise. Those two things are going to be the most important thing that you can do in the interim. And there's a number of breathing techniques. I think oftentimes for anxiety, it might be 3-3-3 breathing. Breathe in through your nose for 3, hold for 3, exhale for 3. Something like that. But even the very fact of just saying to yourself, now I'm breathing in and now I'm breathing out. That very simple exercise can be helpful. Make it a little more complicated. Breathing in through your nose for a count of 5, and then exhaling for a count of 6 or 7. In other words, exhaling, the number doesn't matter, but you're exhaling for a couple of seconds longer than you're inhaling. And again, you're breathing in through your nose, you're breathing out through your mouth. But I know people say, I've had people say to me, so you've been a therapist for more than 40 years and you're telling me to exercise? And again, I'll go back to that point that I had before. Regulating your body is the best way to regulate your mind. Doing jumping jacks, just activities, yard work, walking the dog, anything that you can do to move, taking steps instead of taking an elevator, parking when you go to the shopping mall, parking at the far end of the lot and walking, anything that you can do to regulate your body is going to be one of the most, if not the most effective strategy for managing your anxiety and depression.
Great.
Thanks, Jim. We're going to do about 5 to 10 more minutes here. We have lots of good questions. We're not going to be able to get to all of them, and we'll try to look at them and maybe send out some other information to folks based on things that we think parents are interested in knowing about. We really appreciate the people who are submitting questions. There's been a few questions about what happens if you're trying to talk to your child and they're really resistant. They really don't want to open up no matter what techniques they're trying, and they're even resistant to intervention. They're denying that they're thinking about harming themselves, but the parent might suspect that that's not really the case. What advice would you have for families in those situations?
I think maybe trying to get a consult, maybe with one of the school counselors. I mean, you have a pretty sophisticated counseling group in the school system, and I think that they may be a good source for getting consultation about maybe somebody reaching out to your child is sort of that they're more likely to open up to. But that is common, and I think sometimes you've got to be careful about sort of how much you push. But engaging activities, maybe you can get your child to sort of, rather than sit down and talk, maybe go for a walk together and just, if as much as you can, ask those open-ended questions, just like, what's important in your life? Asking a young person that, I think, can often lead to a good conversation. And sometimes the answer is maybe something that you don't want to hear when they talk about what's important, and maybe something that you have no interest in or you think is not particularly healthy. But let them tell you what's important in their life. I think that kind of a question, I think, goes a long way. But it may take some time. It may take some time, and there may be other people that can help you with that. Maybe an uncle or an aunt could be helpful, or there's a next door neighbor, or a coach or a scout leader, somebody else that sort of has the ability to sort of open up and get your child to talk a little bit more.
So I guess another question is, I think when we think of our own families and families that I know that families that I've met with in the past, my career, my 25 plus year career, everyone has a history around what happens with their family. And I remember even my own family talking about health history at the holidays of, my uncle happened to this and this kind of illness happened to my aunt, and that side of the family trying to patchwork together our own history. So when families have a history of mental illness or anxiety, depression, and even its parents, like, how much should parents share? If it is a parent, how much should they share about their own history with their children?
I think it probably depends on the age, but I think as the older that kids get, the more it makes sense to trust them with that information. I think there are some illnesses, there are some mental illnesses, right, that may have a genetic component to it. And so you want your child to sort of have that information. And some of these conversations are very hard, but I can promise you that no child has ever grown up and said, I'm glad my parents lied to me. So as being honest, your child, what they can tolerate developmentally, and having that conversation at the right age, I think can be really useful. And again, that also goes to reducing the stigma around mental health and asking for help. And that's one of the things when I sort of talk about shifting the narrative, I think that's one thing that we really sort of want to emphasize, that asking for help is a sign of strength. It's not a sign of weakness.
I think that's critically important. When you mentioned stigma too, it reminds me about something you said earlier in your presentation, that youth who are experiencing identity issues relative to LGBTQ plus, whether that's about sexual orientation, gender identity, are at much higher risk of self-harm and suicide. And it's something that is, families may unexpectedly all of a sudden be dealing with their child of middle school or high school age. What advice do you have for families in terms of if their child does come forward or they discover their child is having these kinds of identity developments and either coming out or they suspect that they have an issue and that they're struggling with that? What is the best way families can support their children?
Yeah, I think just being a good listener and allowing your child to tell you what's happening in their life and what's happening to their body, and I think is really key. And getting a consultation early on. If you're sort of thinking that your child, may be struggling with a sexual identity or sexual gender issue, getting a consultation with I would start with your pediatrician, and just being open to that possibility, I think, is really important.
Jim, I think a couple things when I think about what we're doing here in the district as well. We do have a mental health resource page. Dr. Sawyer, I believe that's on our main page, and there's a number of resources that are available to families as a really solid background. So if you're struggling and you're having questions that might not be answered here tonight, we certainly will get the transcript and get those questions out, but you can always turn to our website to look for that information. There's also a question on here for those folks in our community that English isn't their first language. There are translation services on our website, but we also will try and push out information to ensure that those who speak English is not their first language will have those same access to resources that our English speaking friends in the community have.
When this webinar ends, I'll resend all the resources we sent out recently. And when we send that through our school messenger service, there are some automatic translation pieces there if people have checked that box in Power School. So we'll send that out as well. So thank you for recognizing that. Maybe just, we got time for maybe one or two more questions here. And again, Jim, we really appreciate your time. I think that in terms of, I've seen some questions here coming along. What is it that you can do? Again, talking to students around, asking questions, how specific to be. There was a question about whether saying, have you thought about harming yourself versus have you thought about suicide? How important is it to explicitly talk about that? And how do we look at, what some of these other maybe symptoms or things for parents to look for that their child might be struggling with some mental health or depression or anxiety issues?
So I think you just want to start with a really honest, open conversation and just listen. Go back to that acronym again. Wait, right? Why am I talking? Listen to their story. If they're telling you, it's so hard to hear, but if your child is telling you that they're in pain or that you're just feeling hopeless, let them tell you their full story about that and what that means to them before you intervene. I think that really, I think that's probably the best advice I could give. Your child is the expert on their story. I mean, they know how they're feeling. It's so easy for us as parents to sort of jump in and try to protect our children from that pain or tell them what they need to do because we know the answer. But being that sort of good listener, I think, is really the most important thing that you can really do. Asking your child if they're thinking about hurting themselves, I think, is okay as a starting point. But hurting yourself means different things to different people. So sometimes it can be a little bit confusing. So if you are hearing your child sort of describe themselves feeling like a burden and they're feeling hopeless and they're just in so much pain, it's okay to say to them, I've just heard other people sort of talk this way and just listening to how much pain you're in. And it occurs to me that, that you likely have thought about suicide. And I'm wondering if that's the case. So almost normalizing that experience that they've been thinking about suicide can really be freeing for them to tell you, yes, I have.
Thanks, Jim. Just one follow-up here that actually came from one of our counselors who talks about there are a lot of different social media platforms kids are part of where there's things that people share, mental health information, and some of that can be very positive and productive. But there are times when kids are sort of self-diagnosing themselves. So reminding your children when you're talking to them about their social media consumption, that it's still important to follow up and work with a professional rather than self-diagnosing or just assuming something based on social media. One thing that I would add too, there's a few questions about who to reach out to at schools. What happens if the counselor is not available? What are we doing to provide more support? We are certainly, and we'll be making our, coming up, we'll be making our final budget presentation on April 13th, I believe. There are a lot of positions relative to supporting mental and behavioral health that are in the proposed budget for next year. That wouldn't be online until next school year, of course. We are doing all we can. We've actually added some resources during the school year. Just as with accessing counselors outside of school, it's hard to hire people right now because the demand is so high, but we are working, doing our best to do that. But as you mentioned, Jim, we have outstanding counselors, psychologists, clinical coordinators who are board certified behavior analysts. Another group of extraordinary professionals we have in our schools are our nurses. And sometimes parents are more familiar and have talked to the school nurse before because of other issues their child has had, just typical illnesses. And if that's someone, would rather you call the school nurse to reach out just to make a connection, and they can work with you or direct you to the appropriate person at school. But any way you'd like to make a connection with us at school, we will try to help you. Another question that came up is, sometimes students are resistant to wanting to go, even if they have access to counseling sessions, because they're worried about losing their spot on the team if they're on an athletic team, or they're worried about missing that big exam or that project. And how can we make sure that students are getting the message that it's okay, and see if you're seeking help for something, and we can maintain confidentiality, but we'd rather you get that support and it's not going to have a negative effect. And I think that's something we do a better job of than we probably did over time. But that's something that I will be talking with our leadership team about, and conversely, down to educators and coaches and all different support staff in our schools. We need to be sensitive to these kinds of issues. And I think our educators and our staff, by and large, have been doing an excellent job of being more flexible, just given the various needs students have had during the pandemic and as we're coming out of it, hopefully. But that's something that's important and on our mind. So again, we will send out some information right after this webinar ends. We will also be following up based on some of the questions here that we couldn't get to this evening. Jim, any final thoughts you'd like to leave our parents and other attendees with?
Yeah, I think just sort of following up on what you're saying about kids being resistant, I think it's a good idea for parents to sort of, check in with the team coach or with the drama coach and say, hey, my son or my daughter is going to, be missing this sort of practice or whatever. And I just want to make sure that that's okay, because it's for a really important reason. And I think that reassurance would be really helpful. And the other thing is, if your child, especially your adolescent, is sort of resistant to counseling, propose the idea of a consultation. I think sometimes just sort of saying, hey, let's go together and sit down and kind of hear what kind of ideas people have, and then we can make up our own minds about what we want to do. But presenting it as a consultation rather than sort of a commitment to therapy going forward, I think is oftentimes a good start.
Thank you, Jim. Todd, any last thoughts from you before we wrap up?
No, I just want to thank both you and Jim for helping coordinating this event for our community. There's certainly a number of questions that unfortunately we didn't get a chance to ask, and we certainly will be following up. So we'll be working on that. And I think you said that, but I just want to thank everyone for turning out as well. We had over 400 attendees, it looks like, Dr. Sawyer. So a really good turnout, and thank everyone for their time tonight.
Thanks, Todd. We appreciate it. And I want to thank all of the team members who we've been working with to try to address, again, this ongoing crisis that we're experiencing. Even some of the comments and questions in the Q&A are very sobering. As Todd mentioned, some families who have recently had family members who have attempted suicide. This is something that is clearly something that we want to make sure that we provide as much information and resources as we can through our channel as a school district. It's something that's important. I think, as Mr. McCauley mentioned, we want to make sure we continue to develop a culture where students feel accepted for who they are unconditionally, where they feel that they belong, where they feel that they don't have to worry alone, and that asking for help is a sign of strength. We need to keep reinforcing these kinds of messages. We ask that you, as parents, who are also have lots of influence in the community, the parents in this community have always been terrifically involved, whether that's in youth sports or scouts or robotics or the myriad kinds of activities, your church communities. And so hopefully with some of the information you have this evening will help you, and please spread that information as you can. The more we remove the stigma of talking about mental health, the more likely it is that we'll make sure that students, young people, and all of us are able to get the help we need. It's something that every family, every individual, none of us go through life without being touched by issues of mental health. And the more we can know the right ways to approach it, but most of all, it's asking, reaching out for help, being open and honest about what those issues are. And certainly as a school district, we'll do everything we possibly can to help you and the students that we serve especially. So thanks for tuning in this evening. We appreciate you being here. And again, this is being recorded. We'll post it as soon as it's available for viewing, and I'll get those resources out by email very shortly after we end this. Thanks, everyone, and have a good evening.